Ligaments of the reproductive tract. The ligaments of the reproductive tract are a series of structures that support the internal female genitalia in the pelvis. The ligaments of the female reproductive tract can be divided into three categories. Broad ligament, a sheet of peritoneum associated with both the uterus and the ovary. Uterine ligament, ligament primarily associated with the uterus. Ovarian ligament, it is the ligament primarily associated with the ovaries. Collectively, these ligaments are tough and non-extensible. They act to support the female viscera and provide a condyle for the neurovascular structures. In this article, we should look at the attachment and the anatomical relations of the ligaments of the female reproductive tract. Broad ligament. This is the flat sheet of the peritoneum associated with the uterus, fallopian tubes and the ovaries. It extends from the lateral pelvic walls on both sides and folds over the internal female genitalia, covering the surface anteriorly and posteriorly. Subdivisions. Anatomically, the broad ligament can be divided into three regions. Mesometrium surrounds the uterus and it is the largest subsection of the broad ligament. It runs laterally to cover the external iliac vessels, forming the distinct fold over them. The mesometrium also encloses the proximal part of the round ligament of the uterus. Mesovarium, part of the broad ligament associated with the ovaries. It projects from the posterior surface of the broad ligament and attaches to the hilum of the ovary, enclosing its neurovascular supply. It does not, however, cover the surface of ovary itself. Mesosalpinx originates superiorly to the mesovarium, enclosing the fallopian tubes. Here we can see the three parts of the broad ligament: mesometrium, which is yellow in color, mesophalanx, which is green in color, and mesovarium, which is red in color in the sagittal plane. Anatomical relationship. The broad ligament is related to many structures within the female pelvis. It is attached to the uterus, fallopian tube and the ovary. These organs are supplied by the ovarian and the uterine arteries, which are also contained with the broad ligament. These other ligaments of the female reproductive tract are located within the broad ligament. The ovarian filament, round ligament of the uterus, and the suspensory ligament of the ovary, also known as the infundibulum pelvic ligament. Ligaments associated with the ovary. There are two main ligaments that attach to the ovary: the ovarian ligament and the suspensory ligament of the ovary. Ovarian ligament, this is attached to the ovary inferiorly. It connects the ovary to the side of the uterus. Structurally, it is fibrous band of the tissue that lies within the broad ligament. It joins the uterus just below the origin of the fallopian tube. Suspensory ligament of the ovary. This extends outward from the ovary to the lateral abdominal wall. It consists of the fold of peritoneum. Thus, some sources consider it to be the part of the broad ligament. The function of the ligament is to contain the ovarian vessels and nerves: ovarian artery, ovarian vein, ovarian nerve plexus, and the lymphatic vessels. Major ligaments of the ovary. This is the ligament of the ovary, broad ligament, and the suspensory ligament. Ligaments associated with the uterus. There are number of ligament structures that attach to the uterus. They can be divided by where they attach to the uterus. Superior aspect. They are supported by the broad ligament and the round ligament. Middle aspect. They are supported by the cardinal, pubocervical, and the uterosacral ligament. The interior and the inferior aspect of the uterus is supported by the structure of the pelvic floor, the levator and perineal membrane, and the perineal body. Round ligament. The round ligament is the remnant of the embryonic gubernaculum. It originates on the uterine horns, the point at which the fallopian tube enters the uterus, and attaches to the labia majora, passing through the inguinal canal. The round ligament can be a source of the pain during the pregnancy due to the increased force placed on the ligament by expanding uterus. Cardinal ligaments. They are also known as the lateral transverse cervical or the McInroth's ligament. They are situated along the inferior border of the broad ligament and the house of the uterine cavity and the uterine veins. These ligaments arise from the side of the cervix and the lateral fornix of the vagina. They provide an extensive attachment of the lateral pelvic wall at the level of the ischial spines. Some fibers of the cardinal ligaments interdigitate with fibers from the uterosacral ligament. When a hysterectomy is being performed due to the malignancy, the cardinal ligaments are often removed as they are common reservoir of the cancerous cells. Pubocervical ligaments. The pubocervical ligaments are the bilateral structures which attach the cervix to the posterior cervix of the pubic symphysis. They function to support the uterus within the pelvic cavity. Uterosacral ligaments. They are also the bilateral fibrous band which attach the cervix to the sacrum. They are also known as the rectouterine ligament or the sacrocervical ligament. They support the uterus and hold it in plane. This is the overview of the uterus and the fallopian tubes and the associated ligaments like ovarian ligament, round ligament. The major ligaments of the cervix is transverse of the cardinal ligament, uterosacral ligament, pubocervical ligament. Thank you.